Today we'll be talking about hair disease, hair disorders for which patients come to us. I am Dr. Debjit Kar, practicing in a place called Rourkela in Odisha, and we will be talking about what kind of hair do we have, how do we have that, what care should we take regarding daily care and specialized care and all that. Now before we start about what is good or what is bad, I would like to inform every one of you, I would like to educate you that what is normal, because only if you know what is normal, then can you know what is abnormal and you can come to a dermatologist for treatment. Now what is normal? 50 to 100 hair fall on an average is considered normal. That may go up to 150 is even considered normal. So a person having 100 hair fall or 50 hair fall per day should not feel that he or she has some disease. So it may be very much physiological, that is very much normal happening in our body. Just like we sweat, we pass urine, we pass stool. In the same way, around 50 to 100 hair fall per day is normal, which may be less in some days or some months or some season, or which may be more in some days. Now if you have excess hair fall continuously for more than say 4 or 6 weeks or 8 weeks, I think only then you should worry or come to a doctor, or you should if you see a definite patch in your scalp, then you should come to a doctor. Now the day you oil or shampoo your hair, that day the hair fall is double, maybe double, that is around, suppose you are having 50, that may become 100, again that should be considered as normal. What we normally get patients who get panicked when they see a lot of hair falling off on the day they shampoo their hairs, especially when they go to a parlor or a salon where in a white basin they wash their hairs and hairs come out. They feel that it is normal. They feel that it is abnormal in fact. So it is not abnormal. The day you wash, you can think it to be like a cloth. You are washing a cloth and only the day of washing does the dust come out. So on the day you wash your hair, the loose hairs which would have otherwise fallen on other days come out all together on the same day, giving us a feel that we are having more hair fall. So you must always observe your hair fall on the second or third day of shampooing. That will give you a rough idea of how much hair fall you are having. So you should not panic on the day of shampooing or oiling your hair. There might be some seasonal variation. We get patients who have a more hair fall during rainy season or winter season. Again, that is normal. If it comes down within 1 month, then it's fine. If it doesn't come down, then you may definitely come to us. Then coming to hair loss, as we age, 10 to 15% hair loss per decade is again normal. You can always minimize that by taking some specialized treatment, but suppose 10% hair loss in a decade is very much normal. And why we are under stress is we compare our hairs with other people, but actually the hairs which we have is average of what our parents have, or what average of what our other family members have. So we can't have more than that. If both my parents are having less hair, I am ideally expected to have less hair. I cannot have more hair. So you should consider average of your family and the average hair in your age group. Suppose in your class or in your college, the average hair which a person has, you should compare with that. But what we do normally is we compare with a person who has very good hairs. So that is why we come under stress. Okay, we don't have good hairs and we waste a lot of money. Now another thing which we should know is the nature of hair, whether it is dry, oily. Again, that is 90% genetically determined. It cannot be changed. Suppose you are having curly hairs, that means the root of the hair is producing signals which makes your hair curly. Your hairs will never become straight unless you do some straightening procedure or something. So that is, these things are genetically determined. Some people have very black hair, some people have brown hair, some people have blonde hairs. So that is genetically determined, which you cannot change normally, and you should not worry about that. And whom we adore and we idealize a lot, that is celebrities, even they have hair fall, but off camera. On camera, what you see in advertise is just for advertisement purpose. that we don't have a single hair fall, which is practically impossible. Every person has to have some hair fall every day. That is normal. That is how God has made us to be. Now, why people are so anxious about hair loss? It is because of lot of negative marketing, or you can say negative marketing in the shadow of positive marketing, which is happening nowadays. People are selling dreams. They are promising you big hairs. They are selling packages, 40,000, 80,000 packages you do, and clinics run by quacks which take a lot of money and give you a lot of expectations, and people providing quick fix solution that within 2 months, within 4 months will make your hair dense. But remember, my dear audience, that hair care is a lifelong process. No one can give you magic within 2 to 4 months. It's like telling that you give me 100 rupees and I will make it 1 crore within 2 months. So that is not possible basically. And there is a lot of in last few years there has been lots of fear psychosis marketing. That is, wherever you open a newspaper or a magazine, you see क्या आपके बाल झड़ रहे हैं. These type of quotations create some sort of fear in our mind, which makes us rush to the caregivers and making this a big industry today. So firstly, before coming to a dermatologist, you always think that whether you are normal or you are abnormal. When you feel you are abnormal, whatever I have told you, if you are having something beyond that, then definitely come to a dermatologist. A dermatologist is the right person to treat you and to guide you regarding your hair loss and other problems related to hair. Now, how to know your hair is normal or abnormal? I told you, follow 80% rule. 80% rule is, if 80% of the people in your family at your age have a certain amount or type of hair, and if you are having that sort of, then nothing to worry. Now, many people ask us about how care of hair. It's now available everywhere in print media, in social media, care of hair. So just to sum up, the do's and don'ts is, as you all of you must be knowing, just still a repetition of what you know. Basically, our hair needs two things which are very important. One is protein and one is iron. So any diet which has a good amount of protein, a good amount of iron is always welcome. So protein rich food like dals and all the pulses are very good. You can have milk, you can have egg, you can have green vegetables, which is egg is a very good source of biotin. So these things are very good for your hair. And you can also have nuts. Nuts are a very good source of omega-3 fatty acids, omega-6 fatty acids, which are very good for your hair. Now, if you are having a balanced diet, again, you don't need to spend a lot on these fancy foods. Just have a balanced diet containing the right amount of protein, carbohydrate, vitamins and minerals, which you have read in your class 7, class 8 textbook. That is a balanced diet. Have a balanced diet. Have a good amount of water, that is around 2 to 3 liters per day. That is enough for normal people. If you are not getting result out of following these days we are into lot of junk food. Basically, we have to change our lifestyle to get a good hair, in fact. And especially for females, I would like to tell that females are into a lot of dieting to maintain their figure. Now, you can't expect healthy hair to go down well with dieting, because once you diet, then you are not taking many important nutrients. So that nutrients goes to the entire body, to your hairs. Now, once you are not taking nutrients, essential nutrients, your body is not getting that, and including your hair is also not getting that. So the basic purpose is to take a good balanced diet containing the right amount of all the vital ingredients. And regarding hair, as I told you, iron and protein and calcium, these are very important. Milk, egg, green leafy vegetables, pulses, anything containing iron, even jaggery or gur is a very good source of iron. So these things can be taken. And styling aids, okay, now I am a very practical kind of doctor. I never tell my patients don't do this. What I would like to suggest you is avoid doing this. Do these things as minimum as possible. That is pressing your hairs and using styling aids. Okay, styling aid may not be good, but okay, once in 2 months, 3 months, 6 months, it's fine. It doesn't damage your hair permanently. But if you do anything in excess, if you do it regularly, then definitely the hair will take a beating and you will have severe hair loss. Now, what is the role of dermatologist? The dermatologist is a person who will identify what problem you have. Now, in today's times, people don't blink and their eyelid while spending 2000 or 5000 or even more than that for a hair spa, and maybe around 500 to 1000 for just a shampoo at a spa, a salon or a parlor. But a few hundred of rupees to a dermatologist seems costly to them. So always come to a dermatologist. He or she is the right person to guide you, to tell you what your problem is. Alarming signals. Alarming signals when you should rush to a doctor is if you have sudden increase in hair fall, which is more than 100 to 200, persisting for more than 4 to 6 weeks, you are developing a definite patch, then definitely you should come to a dermatologist. Now, I would only request my viewers, my audience, that never be very anxious, never try for zero hair fall. Zero hair fall is a myth, biggest myth. Zero hair fall kabhi nahi hota hai. So you can reduce your hair fall by taking care, either home care, or you can come to a doctor. If you can spend a bit of money, then you can come to a doctor. Doctors' fees and medicines are not that costly as we assume it to be. So a single consultation, obviously with a prior appointment with proper question and answer session and clearing your doubts from your dermatologist, will go a long way in keeping your healthy for a very long time. Thank you.